Hi, good evening, everyone. Welcome to this impromptu segment of our webinar. Basically, hold on, I don't know how to do this. Let me just settle this first. I hope that firstly, maybe you can unmute yourself, and I will just admit more people. Okay. Welcome, Suzanne, who is my Facebook friend. There's a lot of my Facebook friends here. So let me see whether, how do I share screen? Resume share. Okay. So it's I hope you all can unmute yourself, because the background sound is very, very difficult to concentrate for me. When you guys come in, can you please unmute yourself, please? Mute. And I'm trying to mute everyone because no one is muting themselves. Okay. Okay. Basically, today we want to discuss ivermectin or ivermectin, depends whether you say IKEA or IKEA. And I'm Dr. Betty Tay. I'm actually a consultant cardiologist. I at no time admit that I am an expert in the treatment of COVID or the pharmaceutical treatment in any way. Okay, so I'm not a COVID expert. I'm here because there's been a lot of interest, and I'm here because I'm also interested in this topic, ivermectin. Okay, I am sorry because I can't concentrate on my presentation because there's too much background sound. So if you can just unmute yourself. And I'm going to Chom. Okay, Chom is my friend. Chom, hi Chom. Is it possible for you to be a co-host and admit people? And so I'm making you co-host to admit people and also to unmute people, yeah, while I give the talk. Okay. Firstly, as I said, so this is actually just my interest. So this talk is basically from my research and my reading. So I make some slides, and basically it is on the recent subject of evidence in the use of ivermectin. Okay. So we need to know a few jargons. Now, the first jargons we like you to know is actually prophylaxis and intervention. Sorry, there's a typo there. Prophylaxis and intervention. Now, prophylaxis means the prevention of a disease, okay, by medication. And intervention is when you treat the patient, okay. You need to know what is in vitro and in vivo. So in vitro means that it is an experiment done in the lab, okay, maybe with you know, those dishes that you see where we can actually paint the organism onto this petri dish. In vivo means that it is in either animal study most times, okay. Antiviral means something that can kill the virus. Anti-inflammatory means something that can reduce, okay, can reduce the inflammation. This is because I really hope you can unmute yourself, please. Okay, anti-inflammation is important here because a lot of the disease process in COVID, we have come to know now is actually due to inflammation, okay? And you need to know what is randomized controlled trials. So in medicine, when a doctor prescribes a medication to you, most times there are already evidence, okay, from research that this medicine is beneficial to you compared to if you are not on the medication. For example, in hypertensive patients, okay, most trials will show that by treating a patient for hypertension, okay, you will be able to reduce the risk of kidney failure, heart failure, okay, coronary artery disease, and a stroke. And how do we know that? Because we do randomized controlled trials, whereby we actually, okay, we actually take a group of patients and we randomly give them either medicine or placebo. And neither the doctor or the researcher or the patient knows what medication they are taking, either the real medication or the placebo. It is only at the end of the trial that you open up this, you know, like a gift to see whether the patient is on medication or placebo. Whereas an observational control trial, it is where we follow up the patient and we observe, and it is not without bias. Okay. Now you will hear a lot about peer review because when you do this recently with this Ivermectin, people are suggesting that it is not you know, effective. It is not good enough, the evidence, because there's no peer review. And then you will come to know what is meta-analysis. Meta-analysis is whereby, okay, when you have trials, but they are very small trials, maybe 100 here, a few hundred there, and you can't come to a real conclusion. So what some of the authors do is they collect all these trials, okay, maybe 13, 20 of the similar study. In this case, we will actually do a meta-analysis of ivermectin trials and then come to a conclusion statistically. Okay, then we will talk about dosage and what is generic. Generic is a drug that, in actual fact, you have lost the patency and anyone can make the medicine. Okay. Okay. Again, I need to check somebody's background sound is on. I really hope you can unmute yourself. Okay. Okay. So now we have got all these jargons out of our way. Anyone has any question, please just stop me. Okay. How do I do this? Okay. So now FDA, okay, as recently as May 2021 said, you should not use ivermectin to treat or prevent COVID-19. Okay, and this is like 18 months after the onset of COVID, a real pandemic, very difficult to control, even now with the ongoing vaccination program. Okay, and they went on to say FDA has not approved ivermectin for the use of treating or preventing COVID-19 patients. Okay, and ivermectin is not an antiviral drug. Okay, this is actually from a poster from FDA. Okay, so FDA said ivermectin is not an antiviral drug. Is it true? But there's been evidence that it has antiviral activity, and this has been shown in many studies since 2012. Okay, so ivermectin is not just an anti-parasitic drug. It is actually an antiviral drug too. Okay. And the WHO advises that ivermectin only be used to treat COVID-19 within clinical trials. Means that we cannot give it freely. Okay. And again, I ask this question, why? Because WHO has actually endorsed ivermectin from a long time ago, which I'll show you evidence. Okay, so ivermectin is almost as old as me. It's been around for 50 years. And since 1988, when we started using ivermectin on human beings, because before that we were using it on animals, okay, it has 300 million people each year take ivermectin. Okay. Throughout, and this is through a mass drug administration program which treats billions of the poor of parasitic disease in countries that are most underprivileged, okay? And it is a safe drug with minimal side effects. Then you ask, okay? Now, as I told you, this is actually an article, a journal that is published in BMJ in June 2020. That is exactly a year ago, or more than a year ago. It says that ivermectin, okay, when they look at a systemic review from antiviral effect, okay, it has many potential effects to treat a full range of disease and even antiviral and anti-cancer properties, okay? And it has been shown to treat or has effect on Zika virus, the dengue virus, yellow virus, number of viruses, both mRNA viruses and DNA viruses, okay? Now today, I will tell you the evidence that has been collected by this and published in this American Journal of Therapeutics. Okay, now this is a recent journal which was published in between May and June. Okay, and it has studied a huge load of evidence about ivermectin, which we will share. Okay, so one is when we look at ivermectin, okay, without looking in human being, okay, we look at it in either animal study, okay, and we have shown since 2012 a growing number of cellular studies. Cellular means in vitro. It demonstrated that ivermectin has antiviral properties against an increasing number of RNA virus, and COVID-19, as we know, is a RNA virus. Okay, so we go on. Okay. And in 4 of these studies, ivermectin was identified to have the highest, okay, binding factor affinities to the spike protein. And we know that the spike protein is a very important element in the disease process in COVID-19. Okay. Now this is the same, this spike protein is the one that actually stick on to the membrane cell of our body and cause all the effects that brings about the disease. And this mechanism, okay, is written here, by which the viral antibody, those generated by Pfizer and Moderna vaccine, okay, helps with the prevention of the disease. So they are trying to say that ivermectin works the same way as this vaccination, okay? And then we go on. Let me just show you. This is a very busy slide, but it's a very simple. Okay, so the red color thing is actually ivermectin. Okay, what it does is it then, okay, interact with the spike protein, and the spike protein then cannot attach itself to this ACE receptor. Okay? Can you please unmute yourself? Hold on, sorry. Alex Lokman, I've unmuted you many times. Okay, so when this virus with its spikes cannot then attach itself to this green color receptor, okay, it cannot enter the cells. And only when it enters the cell, it will cause damage to the lung, to the liver, okay, and it will cause a lot of thromboembolism, which is actually a clotting of the blood cells. Now, so we have evidence to say that ivermectin is an antiviral that is effective. We have evidence to say that, okay, both in animal study, in vitro and in vivo, that we have seen it prevent, okay, reproduction of viruses. Now what we want to see is whether this actually can be translated in human being. Okay, so this study shows exposure prophylaxis study of ivermectin to prevent transmission. Basically, these are patients. This is a prophylaxis study, means in a group of patients or a group of subset of people that do not have, okay, COVID-19. They do not have. So whether it works in preventing them from getting ivermectin. So what it has shown is data are now available showing large and statistically significant decreases in the transmission of COVID-19 among human subjects. Okay. Now, most of the studies in ivermectin are done in the third world countries like Bangladesh, Egypt, okay, Southern America. Okay, so we will have a lot of studies there. And most of the time, they are not done, okay, sponsored by a large company, because ivermectin is a generic drug. It's been around for 50 years. So there is no money to be earned from doing research. So most time is self-funded from the interest of the doctors involved. So for example, here you will see Al-Gaza in Egypt randomized 200 healthcare and household contacts. Okay, 100 of the patients were given a dose of 0.5 milligram per kg on day 1 and the second dose on day 7. Okay, in addition to wearing personal protective equipment. Whereas the 100 contacts that of the control group were only wearing personal protective equipment. And they found a large and statistically significant reduction in contacts testing positive, okay, using PCR, okay, when they were treated with ivermectin, 2% versus 10%. Sorry, okay. And another one showed that, okay, 340 patients, 200 plus were treated and 112 control. So this randomized controls trial, which is RCT, I'm a bit curious why, if they randomize it, you have double the numbers that are treated than compared to the control. So I'm a bit skeptical about this. But what happens is when ivermectin was given twice, again, this time is different. Just now it was first day and the 7th day. This is first day, okay, and 72 hours later. After 2 weeks, okay, there was a large and statistically significant increase, okay, in COVID symptoms among household members treated with ivermectin. So this is, again, not part prophylaxis, because this is patients who have been positive. So sometimes you have to take this study with, you know, with a bit of knowledge about how research are done. Sorry. Okay. I'm not good at this. I'm so sorry. How am I doing this? How did I do this? Okay, good. Okay, we're here. We were here. And how come I can't do this? Okay. So this is another one. Okay. This is where in Bangladesh, they did a study, which was an observational study of 118 patients. Okay. And in this group of patients, this study, okay, found that where they treat the patient, okay, they gave healthy volunteer ivermectin, okay, for 28 days. and match them to healthy control who did not take the medicine. Okay, and the 131 treated with, so these are two different studies, one done in Bangladesh, okay, and another one done by Carvalho. And you can see that there is a lot of differences in the kind of treatment regime that they give. Some give ivermectin as drops taken by mouth 5 times per day. Okay, some, but after 28 days, none of those receiving ivermectin in the prophylaxis group tested positive. Okay, whereas 11% of them became patient in the control arm. And in a much larger group, okay, of 195 healthcare workers, they found that over a 3-month period, there were no infection at all recorded among the 788 workers who took ivermectin prophylaxis weekly. So regardless of how you gave your ivermectin, it seems like it works, okay? And then this one took 12 milligram weekly. So this is 12 milligram weekly, okay? And 3.5 contracted COVID-19 and only 21% of the control. So there is a lot of question mark about, let's say, the dosing, okay? But there is no doubt that regardless of how you gave, as long as there are more than one dose, that the result is usually quite significantly better. Okay, so the need for weekly dosing in the Carvalho study over a 4-month period may not be necessary at all, because in the recent Dhaka, Bangladesh trial, okay, and the interventional group took 12 milligram once monthly now, once monthly for 4 months, and also reported a large and statistically significant decrease in infection, 6.9 versus 73%. And this is a huge, huge difference, okay? So I won't go into every trial, but almost all the studies showed a significant reduction in the number of COVID cases in prophylaxis. No matter how I do it, I always get it wrong. Hold on, huh? You see, I don't know. If I use it this way, I use it this way. Oh my God, I'm so far back. Okay. Hold on, huh? Sorry, guys. Okay, I'm getting better. Sorry. Okay. Now this is a study. So we have gone through this. Okay. This is a study where we do in cities, not in patients, not in a cohort of patients, but in cities. So this is like an epidemiology study where they did it in Brazilian cities, okay? And you compare with and without ivermectin distribution, mean they distributed ivermectin in campaigns. And you can see that there is a decrease, a definite, obvious reduce, okay, in or decline in new cases between June and August 2020. Okay, if you compare south of Brazil, okay, in the north of Brazil, in the northeast of Brazil, compared the city that is in bold and the city that is underneath this, okay, the reduction is huge. Okay, again, I'm so bad at this. Okay, now when we look at the death rates among this region, okay, so again, those that they distributed ivermectin to the citizens of the city, there was a huge reduction, even up to 65 to 75% of death, okay, each week. Again, Oh my God, I'm so sorry. Oh my God. Okay, I'm sorry, I'm using this Apple thing and it's so sensitive that I am not sure every time joy. And
Dr. Betty, maybe you try using the arrow keys on your keyboard.
yeah, cannot. I tried that just now, many times a day. It's not like how you call it? The I tried that so many times. Okay, I'm getting better at it. Okay, so when we look at now, instead of prophylaxis, we look at the efficacy of ivermectin in treating mildly ill patients. When you look at that, okay, there were 7 trials, okay, inclusive of 3,000 patients with mild outpatient illness that completed, okay, either 7 randomized control trial or 4 case series. And the largest one was from Bangladesh again, targeted 400 patients, okay, with 363 completing the studies. Now in this study, okay, they gave tetracycline and azithromycin, okay, in the reason is unclear, okay. But what they showed was, okay, important clinical outcomes were profoundly affected, with increased rate of early improvement, which is 60 to 44%, and a decreased rate of clinical deterioration. Okay, so given this, okay, there were only 2 deaths observed, and both of them were from the control group. Okay. Now, a medical group in Dominican Republic, I think it's Central America, okay, reported a case series of 2,688 consecutive symptomatic outpatients seeking treatment in emergency. Most of them were diagnosed within a clinical algorithm, and the patients were treated with a high dose ivermectin of 0.4 milligram per kg. And only 16 of these 2,000 plus required subsequent hospitalization with only 1 single death. Okay. In another case series of 100 patients in Bangladesh, okay, and this is half the dose, they found no patients requiring hospitalization or died, and all patients' symptoms improved within 72 hours. Now, from just now, we have done prophylaxis, we have done in mild patients with no symptoms. Now we're looking at hospitalized patients, okay? And studies of ivermectin among most severely ill hospitalized patients, okay, included 6 randomized trials, 5 observational control trials, and a database analysis study, okay? The largest was by this Al-Ghaza, again from Bangladesh, Egypt. 400 patients were randomized into 4 groups. Okay, what were the groups? Okay, group 1 and group 2 were mild or moderate illness. One treated with 0.4 per kg of ivermectin. Okay, the other group did not receive, but did receive standard care. Okay, there was a statistically significant lower rate of progression, okay, in the ivermectin treated group, which was very significant, 1% compared to 22%, with no death compared to 4 deaths. Then the group 3 and group 4 were severely ill patients, okay, with group 3 again being given a single dose. Okay, these are all single dose and just 1 dose, okay? Whereas group 4 did not receive anything, did not receive ivermectin, but received standard care. And in this severely ill group, they did not define what severely ill group. I think it would come to our category 4 or 5. The difference were even larger, means with lower rates of progression, 4% versus 30%, and mortality of 2% versus 20%. Okay, so So meta-analysis of above controlled treatment trials were performed by the study authors, okay, to look at time to clinical recovery and mortality. The consistent and reproducible signal leading to a large overall statistically significant benefit from within both study design. Okay. I'm so sorry lah. That's the problem. Always host webinar, but never present. Oh, I'm so irritated with myself. I hope you're not irritated with me. I'm so irritated now. And I can't.
Dr. Betty, you're using 2 fingers to swipe, right? 2 fingers
Yes.
to swipe.
So I do what?
2 fingers to swipe.
Yeah, I'm using 2 fingers to swipe.
Oh, okay.
Only 2 fingers to swipe. No, I'm using 2 fingers to swipe, but sometimes I swipe, it goes to this side. Okay, I try again. Okay. Really have to be like tender, loving care like that. Okay, we've gone through this, we've gone through this, we've gone through this, we've gone through this. So now the most amazing part is Ivermectin has even reported to be useful and beneficial in long COVID syndrome. Okay, let's not go through this, okay, because I want to show you this amazing graph. This is an epidemiological data again, okay, showing impact of widespread ivermectin use in the population. Means they distributed ivermectin to certain cities and then they drew a chart, okay. And as you can, let me just explain to you, the gray is actually number of COVID cases, okay. The red is actually the total death per 100,000 people in the city. Okay. Now this, the blue is COVID cases. Now the gray on the left-hand side, the broad band, is actually before ivermectin intervention. Okay. The white, okay, is after ivermectin was served to the population. And as you can see, okay, you can see even though the numbers of COVID patients may go up slightly, the death may go up higher because, of course, because of the resources, the number of beds, okay. But the moment that ivermectin was served to this population, the number of death came down, okay, despite the fact that the number of COVID cases may still spike on and off. In some cities, the COVID cases were just coming down too. Okay, can you all get this? Okay, this was done in Paraguay. Okay, and this dark blue at the bottom is up the number of weekly deaths. Okay, in the town that has been served ivermectin, okay, which is the bold blue line, compared to other cities. Okay, so one is actually the weekly COVID-19 death, and this is the COVID-19 cases. And as you can see, okay, you can actually bring it down so well, all the way, compared to this town that has not been served, compared to this town that has not been served, the numbers came down and spiked again. Okay, again. Ayo. Okay, I'm going to curse again. Why is this like that? Huh? It seems to like, how do I do this? No matter which way I do, it's going back. You see? Okay. Ah! how come? Okay. Every time I think I get it better at this. So I think I've just got a few more slides to show. Okay, this is probably, so the evidence base for this, in this clinical, this evidence is, it shows that since 2012, multiple in vitro studies have demonstrated ivermectin inhibits the replication of many viruses. Okay, and ivermectin actually inhibit this SARS-CoV virus replication and binding to the host tissue through several observed and proposed mechanisms. Okay, it has a potent anti-inflammatory properties, and that's why most probably it can actually treat long COVID. And ivermectin significantly diminishes viral load and protect against organ damage in multiple animal models. But that doesn't say anything unless you can reproduce this in human being. But of course, we cannot prove, only we can prove it through randomized study or clinical trials. Ivermectin prevent transmission and development of COVID-19 disease in those exposed to infected patients. And that is true, and we've seen numerous trials done. Okay, ivermectin hasten recovery and prevent deterioration in patients who have mild to moderate disease. And again, there are many trials to prove this. Okay, ivermectin hasten recovery and avoidance of ICU admissions and death in hospitalization in patients, hospitalized patients. Again, proven. Ivermectin reduces mortality in critically ill patients with COVID-19. Okay. And then ivermectin leads to temporarily associated reduction in case fatality in regions after ivermectin distribution campaign has been done. Okay, and it's safe. Okay, it's readily available, and the cost is very cheap. It is probably about $290 for 100 tablets. $290 USD for 100 tablets of ivermectin. And WHO, despite saying that it can only be used in clinical trials, okay, in the setting of clinical trials, have long included ivermectin on its list of essential medicine. And actually, the founder, the person who found ivermectin, okay, Dr. Omaha, I think, from Japan, was given the Nobel Prize for his work done on this. So with that, I'm going to stop the share and then we can discuss. So anything. So my thing is, my contention is, okay, the only way forward is to do a real large clinical randomized trial and compare it to vaccination. And who is going to do that? Who is going to pay for it? That's one. Two, why are the evidence so abundant, but yet everybody says there is no peer review? Okay, therefore it cannot be taken as true evidence. And yet Sinovac has never produced any peer review, okay, papers, and yet it is accepted by WHO. Three is, there is a lot to lose if ivermectin really works in our any community at all, okay, because we have very powerful and big pharma companies that are involved here. Now, what is actually your take on this? Anyone? Okay, so Chom said, I'm not from the medical background. The study done by Prof. Alcazar appears fraudulent and his papers were retracted recently. Does it affect the meta-analysis drawn by Dr. Andrew Hill or any of the data here? Okay, Dr. Gaza, this was in the Guardian, if I'm not mistaken, right? That his paper was actually withdrawn. But in this meta-analysis, okay, in this American Journal of Therapeutic, yes, it does name his paper, okay, it does add in his paper to the meta-analysis, okay. Now, again, when you look at peer review to me, right, peer review basically means that you submit the paper to a group of doctors or a group of scientists that knows about this. And chances are, okay, this peer is like friends, people with connection. If let's say I am the chairman of an association of, let's say, cardiology, and I've made all the right contacts, okay, if I were to submit a paper compared to somebody else submitting a paper that is unknown, okay, it is more likely that my paper will be accepted by my peers, okay? Okay. Lillian said, I don't think it's fair to claim pharma companies are against ivermectin. Okay. I think it is not, yeah, I don't think that statement is fair. You are right. But again, I think that if we were to call for, how do you call it? A true comparison, okay? Like let's say if I were to come up with a randomized control trial, I want to put one group on ivermectin, okay, and one group on vaccination. Now, who would the vaccination company sponsor this trial? What if the results were not favorable to them? Okay, trials cost money. Okay, and why would they do it? But why don't they try to? I'm not for ivermectin or against ivermectin, but I'm looking at the papers that I've studied, okay, and I'm thinking, okay, it has been given to population in cities, and it has worked. What do we have to lose? Okay, what if the vaccination needed a booster every 6 months? Okay, what if the person injecting you did not inject you? Okay, okay. Any idea about FLCCC protocol? Anyone? I don't know what is that. Sorry, again, I claim I'm not I'm just basically discussing what I've read in the last 2 days. Okay. So this FLCCC is Frontline COVID-19 Critical Care Alliance. So what is their protocol on ivermectin? Let me just check while I'm doing this. Okay. So FLCCC Alliance Statement on the Irregular Action of Public Health Agency and the Widespread Disinformation Campaign Against Ivermectin. Okay. So it is a long article. It is May 2021, okay? And the statements are a bit ambiguous, so it may take me some time to get it. It looks like they are for ivermectin, so I am not sure. Please check it out for me. Okay. I believe doctors are allowed to prescribe ivermectin off-label. Why is it a problem now on availability? I can request as a patient. Okay. Now, I don't think it's so readily available. Okay, we do not use it. We do not have such big cases, so many cases of parasitic infestation in Malaysia. So I don't think many doctors actually have the experience with ivermectin. Most time it is the public health that is dealing with ivermectin. Means it's like a program. It is not like I see a doctor, the doctor give me medicine. It's like a campaign kind of program where public health is like vaccination. You know, you go out to the public, you give it. Okay, so it is not something that is readily available or something that doctors are familiar with. Okay, Lillian says our MOH should start our own study urgently and fund it ourselves. Already as MOH spending tons of money to control the COVID. Yes, possible. I also think so. I think that there is no harm, okay, to start like what Brazil and Peru did with, let's say, a small community, okay, because it's been shown to prevent, it's been shown to treat mild and even severe illnesses, it's been shown to actually treat long COVID. So I think that it is possible. We need to always try to
Malaysia Malaysia including
excuse me, do you mind unmute? And I don't understand. Alex Lokman, do you have any question you want to ask? Because I've muted you so many times and you still unmute. Is it because you want to ask me a question? And so let me see if there is any question. Okay. So on Facebook, Mr. YP Yong said, can the drug be purchased over the counter? Can it be taken long term? In actual fact, you don't have to take it long term. Okay. From the studies that we have shown you, I think the one that has taken long term is once monthly for 4 months for prevention, and for treatment, it was either once and followed with either 72 hours later or maybe a week later. So the treatment regime is a problem. The treatment regime is very not standardized for, because as we know, COVID is a very new disease, right? Okay. So we do not have what is the optimal treatment regime. We know that so far, no matter what regime they use, so far many have come out with positive results. Chom asks, MOH said that they started trial for high-risk patient. Oh, so Benjamin Yao asked why doctors seem to be reluctant to openly say they have ivermectin when off-label prescription is not against the law. Well, actually, I don't think many doctors have ivermectin. I think you're more likely to be able to buy ivermectin off Lazada or Shopee compared to a pharmacy or a GP clinic. Because, as I said, it's most likely to be used in livestock or in countries that have a lot of parasitic infestation, that they use it as a program in public health. So I am not sure about that. Anyone else? Again, Alex Lokman unmute. So anything else that we, okay. So from you've checked, okay, from FLCCC is the protocol recommended from, okay. I have not actually read the protocol, so, and I've not even heard of FLCCC until just today. So I need to read that out. And it is a very long article, very heavily worded. So it's very difficult. I need to come back on this for you. Okay. Doctors need to be careful when using any drugs off-label, as this could subject to potential lawsuit. I guess if they do prescribe it off-label. Okay. We use a lot of things off-label. That's also true. Patients, funnily, okay, are very acceptable to things that are off-label, but okay, for example, if you use supplement to treat your diabetes, is that not off-label? Okay, because if you follow the guideline, none of the supplement works. Okay, and patients are so keen on this ivermectin because it's off-label. It gives them hope. It gives them some kind of, okay, this is the miracle drug. They like to hear that. Okay, but what I'm trying to point at is, what if the doctors don't give? What if MOH just distribute? Okay, distribute, okay, to old folks home, distribute through work premise, distribute through, okay, their agency, means like schools, army. Okay, it makes sense, right? Because it is a very cheap drug. So it has to be combined with antibiotics? No, it doesn't have to. Okay, so Jonah says that FLCCC was formed by a group of doctors worldwide since 2020 April. So they found that the protocol helped to treat and cure COVID positive cases when governments are dragging their feet. So they do have a very long article on this ivermectin, which I have not, yeah. Go and read. So what you go is, you go to FLCCC website and you just type ivermectin, a whole list, okay, of articles will come out, including what their guideline is. Okay. Suzanne says MAECC recording of the rakyat invite all MPs and ADUNs to hear the evidence at 8 p.m. Also, there is somebody who's hosting a webinar on the 17th of July, which is just past. 4 medical experts spoke with authority and showed with evidence-based facts and figure why we must have ivermectin to save life and save Malaysia. Please spread the word. Yeah, again, like I said, I showed you the evidence, and I think that it's a worthwhile try. Worthwhile try because it's cheap, it's safe, it's readily available. It can be used in large numbers of patients. Okay, it can be used for prophylaxis. It can be used in Cat 1 and Cat 2 patients. It can be used in Cat 3 to Cat 5 patients with good outcome, which has been proven. It can be used in patients who have long COVID. So why not? Why not? Okay. So I think I'll end here if there's nothing else. I'm sorry if I'm not so familiar with the slides. And I only started doing my slides and my talk yesterday, rushed it today after a long clinic. And I think it's quite fun. Thank you for doing the research on ivermectin. Oh, no need to thank me. I think Benjamin asked me, will I prescribe if you have stopped? Oh, I'm a cardiologist. I'm just hoping the public health people will prescribe, not me. They hope that they will prescribe to me, not for me to prescribe to others. So I think the public health people should get involved in this. Yeah. Okay. See you then. Anyone else? Thanks, Chom.